All right, today we have Dr. Mary Gardner joining us in the vet's office. She's a veterinarian, an author, a public speaker, and the co-founder of Lap of Love, which for those of you not familiar with Lap of Love, it's a service that provides in-home pet euthanasia, veterinary hospice, and pet loss support services. Dr. Mary prides herself in making the lives of our older pets and the people who love them better, so I figured she was the perfect guest to have today to discuss the end of life with our pets. Welcome, Dr. Mary.
Thank you for having me. How are you?
I'm doing great. I'm so happy to have you on today. I was prior to our interview giving our listeners a little bit of a heads up that these are some heavier topics to
Yeah.
discuss, but important ones, and everybody as a pet owner at some point will be dealing with them. So I think it's really important that we are able to talk openly about it.
I know we're such a death adverse society in general, even in human death, right? And so it's not a topic that people want to talk about, but yet they need to talk about it. And then they usually feel better after talking about it. So they just at least know their options, know what to expect, and then can sit back and still enjoy life.
Yeah, absolutely. And I know I just mentioned Lap of Love and that you were a co-founder. And before we dive into all the things, I actually used Lap of Love for one of my dogs previously. And I just wanted to let you know it was such a great experience. And
Oh,
I know at-home
yes.
euthanasia is not for everyone, but I think it's a great option to have. And I can't say how, in a terrible situation, how great of an experience I had.
Oh, thank you for saying that. It is, yeah, it's a personal choice of where and who's around and things like that. And I do feel that they're most comfortable in their home, and we don't have to, do a final ride in the car or anything like that. But also, we're a little bit more comfortable in the home, and if we want to, grieve in our own way, we can without having to worry about who's seeing us or anything like that. So but like you said, not everybody wants that, and not everybody can have that because sometimes we're at the emergency clinic or something like that, and it's unfortunate. So we're very blessed to have such a rewarding career and or niche in the veterinary space, and we love making that last final moment just a bit better.
Yeah, I I agree. One thing I wanted to talk about is I think I'm sure you'll relate to this that as veterinarians, a lot of times people think we are playing with kittens and puppies and running around and it's rainbows and butterflies, but a huge portion of our job is taking care of senior patients and ensuring that they're healthy overall and they're comfortable. And so I think a big part of our job, and I'll be interested to hear you expand on it, is focusing on our senior pets and then also recognizing that age is not necessarily a disease, although it can certainly come with its challenges.
Mhm. Yeah, I always say age isn't a disease, but it does bring dis-ease. And and our bodies do start to age and have, it may not be a failure of an organ or something like that, but we don't have the same reparative processes, we don't have the same energy level, the ability to fight off infections. And so it's just a fact of life even for humans. But did you know that 44% of pets are senior senior or more. So I love double digits. So the more double digits they have, the better, like a teenager, if you will. But 44% are over 7 years old, and that's massive. And so, to your point, everybody thinks we're playing with puppies or kittens, but that's actually only about 12% of the population is a puppy or kitten. Because eventually, obviously, they go to 2, 3, 4 years old, but the majority is actually seniors.
Right. And I think that a really important part for owners listening is bringing your pets in once they hit seniorhood. I think bringing them in twice a year is really important. Just that way we can lay our hands on them. We're running lab work on an annual basis. We can see how they're doing. We have a good baseline, and then if something does come up, we can be on top of it and focusing on that preventative care I think can make a huge difference.
Yeah, and I was just this morning I was somewhere and this gentleman says, "Oh, I have a 12-year-old boxer." And this was just I wasn't in a clinic or anything, so this is just random. And he's like, "Oh, and her hips are really bad." And so it's a very common thing I'll hear is, "Well, she's getting old, and what are we going to do?" And I'm like, and I wanted to, of course, go into my whole talk and
Yeah.
conversation, but I didn't have time. So, what really makes me sad, and so many people think that doing euthanasias is what makes me sad, I do get sad, but that's not what makes me sad is but what does is that so many older pets have not been to their doctor. And it is about 49% of dogs and cats are not seen by their veterinarian the last year of life. So let's just round that up to 50% because it's a lot easier to talk. Half the pets that we euthanize in the United States have not been to their doctor the year before they pass. And that's where a lot of stuff happens where we can help manage. And whether it's pain relief or anxiety relief or just products and setting up their house. This gentleman with this boxer, he's like, oh, she just, she can't get a grip on the floor and she skates all over. And I'm like, oh my gosh, that's so easy to fix. And he
Mhm.
just doesn't know. So I would love twice a year is ideal. We got to get them in,
Yeah.
period. They're not even coming in at all. So how do we get them in?
Yeah. And I think it's like reframing our mindset as owners where, oh, they're just old isn't really the mindset that we want to have because there are so many things that we can be doing to make their life better.
Correct. It's interesting. Like, do we say that about ourselves? When we're going to be 60 70s, right? Like, and something hurts or we can't see as well, are we just going to say, I'm just old so I'm not going to go?
Hmm.
Like, I don't think we say that to ourselves.
No.
And I mean, listen, I'm in my early 50s and I feel like there's a doctor's appointment on my calendar all the time. Like,
Right.
there's just
Right.
I have to go to the dermatologist tomorrow,
Yeah.
and my knees are hurting. So I feel like I'm always somewhere in a doctor's office, but we don't say that to ourselves. So why would we say the same thing for our pets?
Right. And I think a huge portion of it is they can't talk, so we really have to advocate for them and even if you think your pet is perfectly healthy, they still need to go in for their checkup because we are trained as veterinarians to see these issues and help make your life and their life better.
Hmm. Hmm. Yeah, a lot of people will say, "Oh, pets hide their pain, so we don't see it." But I kind of think they just don't complain,
I agree.
right? Like we actually, and also people have goggles on that they can't see things. And I'm sorry, if your pet is slowing down, that's a sign of pain,
Hmm.
probably,
Yeah.
right? Like,
Yep.
so they actually are showing you. We just don't know how to notice it. Oh, you know what? My kitty cat she's not grooming herself anymore. She's just getting old. No, she hurts, therefore she can't groom herself. Or maybe she's got oral ulcers and she can't say anything. And what is she going to do? Complain? Like they don't complain. So they actually aren't hiding signs of pain. They're showing you. You're just looking for a complaint, which they
Right.
don't do. Yeah,
Right.
I mean, now with that being said, they may. So an acute injury, you'll hear them complain because they howl and cry and all that stuff. But chronic long-term illness, like usually they just kind of suck it up, but it doesn't mean they should.
Yeah. One thing that I've had a lot of owners and that I've dealt with in practice and a lot of listeners ask me about is your pet gets diagnosed with terminal illness, we'll say cancer, bone cancer, for example. And
Mhm.
people are really torn between, okay, do I go this much as I can with pursuing treatment versus doing palliative care, which palliative for those listening at home just means keeping them comfortable until the end of life. I see people struggle with that so often, and I think that's a huge part of our job is helping them guide them to their decision that's best for their family, which may not be the same for everyone.
Totally. I mean, you said it perfectly. And because neither is right or wrong, right? What I should say is neither is wrong.
Right.
And if a family wants to, in your example, do if they can do radiotactic things or amputation and then some other medications and get another year from their pet and they can manage them financially, physically, emotionally, and time wise, and they can't, then that's fine. But if they also have all those things, they have the time, but still don't want to, that's also fine. And but I think the rule should be they should not be suffering. So I don't I and that's not just end of life diseases. There could be a disease. This is a harder thing is you've got a younger cat that's got diabetes.
Hmm.
And some people just cannot manage that disease, the treatment. And so what do we do? So we may not be doing anything until that disease is taken, to a point where then the pet is suffering and then we're going to have to intervene. But And that's, I think, where you and I as veterinarians kind of get a little bit sad, because we know that it's a treatment that's not so difficult. But when we're talking about older, nearing the end, or a few years out, let's say, treatment becomes a little subjective. And what would you do? And even myself, I've done some things for my own pets, and other veterinarians are like, you did radiation? Like, she's a 12-year-old dog. And I'm like, well, she got 2 more years. She got 6 more months. I don't care. Like,
Right.
as long as she's okay going to getting treatment, and the treatment doesn't decrease her quality of life, then I'm going to do that. But it's also okay if I didn't.
Yeah, and I think you said a really important thing is as long as she, meaning your dog, is okay with it too, because it's very dependent on the patient. If I have a dog that's
Yes.
like would hates other people, hates going to the vet, for him it would be horrible.
Yeah, totally. Pet's personality is a massive part of my evaluation of quality of life. And like, I have my current dog, he's got separation anxiety, and he's highly reactive. And so he is such a blessing to me, because he has taught me so much about behavioral issues.
Mhm.
And he's not an aggressive dog to people, or really, as long as he's not around other dogs or cats, he's fine. But he's just so anxious. There's no way I could bring him for chemotherapy or rehab or any of those things, because he would just be, not a good patient, and he wouldn't feel comfortable. So for him, he's got the same mama as my other dog that got chemo. He wouldn't get it, because
Right,
he's it's not good for him, and that's okay.
right. I think a really big take home message I want listeners to hear is whether you pursue treatment or you don't, I think no matter what, we are prone to being like, oh, did I do the right thing? I'm questioning myself. I'm feeling this level of guilt. And there is no wrong. Like you said, there's no wrong in either way that you go. It's really, you have to look at it from a very like holistic approach with yourself and your pet and whatever decision you make that's best for your family. It will never feel 100% right, but I wish I could take away the guilt that so many owners feel.
Yeah. You know what? I think, you said if they don't want to do treatment, I think what we should think about is that palliative care is a treatment,
Hmm.
right? So we are doing a treatment, we're just doing a different one, because there's many different ways to treat something. And sometimes we're doing things for curative reasons, and some things we're just doing things for prolonging life, as long as it's good quality. And there's also treatment as just pain management and quality of life assessment. That's still a treatment option.
Right.
And I just think but back to my point I made, whatever, a couple minutes ago, we got to make sure that their pain and anxiety is being managed. And so it's not okay just to say, well, he's just getting old.
Exactly.
That's not okay, because old age does bring dis-ease.
Right. And so we want to stay on top of it.
Yeah.
I actually the Great Dane that I euthanized through Lap of Love, she had osteosarcoma, which is bone cancer, and she would not have been a good candidate for amputation. Just being such a big dog, it would have been, I think, pretty difficult for her to get around. And so we chose to go the palliative care route. We kept her at home. We got a really great 6 months with her and kept her on pain medications. She was getting around just fine. And so yeah, as Dr. Mary said, palliative care is a treatment option. It may just look a little bit different than what we had in our head. But I think I still got
Yeah.
some really great time with her and was able to keep her comfortable. And I'm grateful for that.
Yeah, totally. And I think that's the thing is I think once we decide on palliative care, just kind of put the guilt aside, and just enjoy and do bucket lists, get a photo shoot, just be present. I always prescribe 30 minutes twice a day of love. And that's it. Just love on your pet, because that is a part of the process. If you were to lose a friend or a family member, you'd wish you had 30 more minutes to say I love you.
Right.
Right? And that's it. So every day say I love you. That's a part of my treatment plan. And that's okay. So it's a different mindset, because you know what? We never want to say goodbye. Never.
Right.
And but we have to. So that's their only fault.
It is definitely a double-edged sword. I think about this a lot where the people where you have your pet who you're rushing to the ER, you find out they're very sick and euthanasia is an option and having to euthanize them in that emergency situation versus in my case, my dog has bone cancer. I'm taking her home. I'm living with her for 6 months, but knowing that she's slowly going to deteriorate. and neither one is great. They both have their cons.
No.
It's both challenging in their own ways.
Yeah, right. Both, I mean, dare I say, both have their pros and
Hmm.
both have their cons, right? Like I think we're so like, oh, I don't want to say that, but one pro is that you don't have to sit there and think about it for 6 months. It's come so fast. You're like, oh, but that's also at the same point a con. And when I've, like you, have had pets with, longer term illness. I mean, most of mine were about 6 months too, once you really diagnosed. And you're every day thinking, every day looking, every day worrying, every day anxious. That's called anticipatory grief too, right? So you're all of those things for months at a time. So that's a con, but a
Hmm.
pro is you get them for 6 months. So both both have their things. But what I don't want, it's just when it is an accident, meaning or fast or emergency, you just don't have any time to prepare. So I do believe having that time, whether it's 6 months or 6 days,
Hmm.
that's okay, because anything is better than emergency.
A little less traumatic for sure.
Yes,
A lot,
totally.
a lot less.
A lot
A
less,
lot less
yes.
traumatic. What are the things that you are looking at? Because I think it's very hard to quantify the quality of life. So people come in and they say, how will I know it's time? And so what are you looking at when you're assessing quality of life in a pet?
Okay, yeah, because this is super subjective. And as veterinarians, we're like all about objective things.
Correct.
Oh, what's the BUN creatinine numbers and
Yeah.
things like that, right? This is absolutely none of those things. And I do love quality of life scales, which is an objective way to measure something that is so subjective, but it certainly helps as a guide, and it asks questions that many of us wouldn't be thinking about, right? So, but to begin, there are four things that I look at. First off, is the ailment that the pet has and how they will pass from it. Now, most of them have multiple ailments. So you might have a dog with mobility issues and heart failure and cognitive dysfunction or whatever, right? So I look at the worst one, meaning which one is going to be an imminent decline and happen fast with an emergency room as an issue, right? And so to me, that's any disease that takes away their ability to breathe. So any disease like heart failure, laryngeal paralysis, the whole list, that the ailment is going to make them have respiratory distress.
Hmm.
That's what I'm going to focus on and say, if we don't say goodbye at a sooner date, then you will be going to your emergency clinic. Like and is that what you want? And no judgment. Some people may want every single second of time with them, and I
Hmm.
get it. And I'm like, are you prepared to be rushing to the emergency room? Like that is going to be the consequence of this, good or bad, whatever. The second we already talked about is the ailment, or sorry, is the pet's personality, right? So how are they managing their treatment? How are they managing their disease? Some things are harder to manage, like anxiety. So cognitive dysfunction, I hate it. It's
Yeah.
horrible.
Yeah. For those listening, I think it's very much like dogs almost get like a dementia. Where,
Yeah, totally. And cats too.
and
So
cats, excuse me.
you'll
And
have a cat, wow, like all
cats.
night, and peeing outside their litter box because they just don't know where it's at. It's kind of, it presents a little bit differently. Vocalization is more with cats, but you'll have dogs panting and pacing and anxious and keeping everyone awake, and they're not sleeping. So quality of sleep is important. But so anyway, pet's personality is very key. Then everybody's beliefs. We are all so different.
Hmm.
And some people may say, you know what, that cat is just my barn cat, and they chase mice and they do whatever. So I'm not going to do treat like other treatment.
Hmm.
So I'm going to euthanize before that's something that is required for good quality of life. It could be, just I've helped junkyard dogs, so I don't know if I should say that. Like, the people sometimes love their dogs that are just protecting the property, but it could also then be a teacup that's in bed with you, or a giant dog in bed with you, and we
Right.
have different ways we view our pets, and also different ways we view our treatments.
Hmm.
And there are some that will say it's just a cat, so I'm going to keep them, take care of them, but then that's it. So we're all so different. And then, and with that being said, there's also some religious differences for euthanasia.
Hmm.
right? I've had many Buddhists that are against euthanasia. And so, okay, well, how do we manage that? Because they also don't want their pets to suffer.
Yeah.
Um, then the last is the budgets, which I talked about also. Like, do they have not just the finances, do they have the time, the physical ability, and the emotional capacity to manage their pets as they're aging? And at any time, if any one of those budgets is up, then I support their decision to say goodbye.
Hmm.
And, somebody could call me on a Monday and they say, "Oh, Dr. Mary, it was like the worst weekend. She wouldn't eat much. She could barely get up, didn't sleep a lot. The list goes on. Will you come today and help us say goodbye?" And absolutely, I will. They could also call me on Monday and say, "We had a beautiful weekend. We did bucket list items. She ate like a champ. Everybody was around. Will you come and say goodbye?
Hmm.
Because that's how we want her last days to be."
Hmm.
And we never think of it that way. But I say, "Yes, I will." So it's okay to euthanize them on a good day when we know bad days are right around the corner.
Right. I think that is so important. I see so many owners where they're like, well, Fluffy's still eating,
Yeah.
and Fluffy's still drinking. And that to me is not an indicator of a good quality of life. If
Nope.
Fluffy can't,
And now
sorry, go ahead.
can't get to the water bowl, right? Like,
Yeah.
I think you have to think about what disease they have. That's why the ailment, like I mentioned, what ailment they have is going to determine what they lose.
Mhm.
And you can have a yellow lab that's got arthritis that
Yeah.
will eat their way,
Into the
to
grave.
heaven.
Yes.
Yeah, exactly, to the grave, right? They will eat their way to grave. That was better. Thank you.
Yeah.
And it's just the disease they have in the pet's, personality and their normal eating habits.
Hmm.
People will say, "Oh, they'll give you a look." Well, the look you get comes when there's so much suffering, you see it present on their face. And I never want to see a look. So
Right.
there's no way I ever tell someone, "Don't worry, you'll get a look," because you're waiting for it to be so bad,
Hmm.
right? Like that it's obvious on a cat's face. So I would never want that either. But it is really hard, and it is a personal decision, but you have to make it with love in mind. And I always say that we suffer so they don't.
Yeah.
And so we have to say goodbye and break our hearts so we don't make them suffer.
Think that's a great point. I just actually euthanized a friend's dog a couple weeks ago, and she called me and she said, I just need you to come look at her name's Layla. Come look at Layla and just tell me that it's okay, that I'm
Yeah.
making the right decision. And so, for any listeners out there that are struggling with this, I think you can really rely on your veterinarian. And it's hard sometimes to even bring up that because you feel like you're your pet's own executioner almost. And so, it's okay
Yes.
to ask your vet, do you think I'm making the right decision?
Totally. And I lecture a lot to veterinarians, and I encourage us to bring it up because pet families are so conscious, like they don't want to do that. And I think we need to
Mhm.
help them. And but boy, we don't want to talk about it. But I think it's absolutely something that we should be talking about sooner than later, so that way everybody is supported and not in a situation that's could have been avoided.
Yeah. And it's true. I've never had an owner say, "Oh gosh, I did it too soon." But I have had many
Yeah.
owners say, "I waited way too long." So I think,
Absolutely. You know that saying, "Oh, it's better a week too soon than a day too late," which is totally true. And asking your veterinarian for evaluation like yours that your friend did with Layla. But so we at Lap of Love, we actually have telehospice services where we will do a virtual conversation with families all around the country just on quality of life assessment of their pets. So it doesn't even need to be in an area that we service, which we do have a lot of those, but if you're in a rural area, wherever that we don't have a veterinarian, then that's massively helpful. And what I do like is showing the home, because how they act in the home is very different sometimes when we bring them into a clinic,
yes, I
and both ways,
totally
right?
agree. Yes. Yeah,
So
how they are at home can be entirely different, especially like if they're sick and they come in and they have this adrenaline rush and they're prancing
yeah.
around. They're at home, they're like a vegetable. Then, they just are totally
Oh
different.
my gosh. It's so true. Like the vegetable comment, it's crazy. They will come and perk up and be good, and they come home and they're just staring at the corner with,
Mhm.
especially with cognitive dysfunction, or they're just so exhausted they can't do anything. And there's kind of a I don't want to call it syndrome's not a good word for it, but it's a phenomenon, I guess, where primary caregivers are usually ready to say goodbye before the secondary or tertiary caregivers, because they're seeing the whole picture. They see the
Mhm.
whole day.
Yeah.
They see the struggles. And
Yeah.
it's not so much a selfish thing, like I'm done cleaning up the poop or, whatever. They see the whole day.
Yes.
Where somebody who comes home at 6:30 at night and the dog gets the adrenaline, is so happy, and they have dinner, and then like, oh, let's all curl up in front of the TV.
They don't know.
They don't know.
Yeah.
So that's just, I don't know if you've experienced that too. It's just very interesting to see the duality at home between family members and how they're never on the same page.
Yes, I agree with that. A lot of times it is one who's like, no, I know it's time, and the other is just not on board. And it typically the one that's not on board is the one that's not doing the majority of the caregiving.
Yep, yep. And like I said, it is not because they're tired giving the care. It's they see it. They just see it way more. Yeah.
If someone wants to go on Lap of Love for that quality of life assessment, is that on the website?
Yep, it is. It's just on the drop down of one of our services, along with, of course, in-home euthanasia, in-home hospice, and then our pet loss support. So it's right there. That's listed there, and it can be really valuable just to have just a conversation, no judgment. We can go over quality of life scales with them, which are very helpful.
Mhm.
And like I said, they could kind of, you could see the environment. But if somebody does want to come into their vet's office, they can also not bring their pet in
Mhm.
and say, this is the list of problems that I'm dealing with. Here's a video of how she's acting at home. Here's some pictures of how the house is set up. And we could still help without the pet being present if it's too much for the pet to come in. So I like to encourage people to do that. And I think we forget that that's okay to do, because this is a conversation. Half the time when I'm in the home, the dog's laying over in a corner anyway, and we're just conversing on the
Right.
couch,
Right.
right?
Yeah, they're not
So,
even a part of the situation. Yeah, absolutely.
no.
I think, and I guess I would love for owners to take away, it's okay to bring it up. It's okay to talk about it. It feels impossible, but it's something that we have to have a discussion, and it's better to do it beforehand and feel prepared rather than doing it at the very last second. So
100%.
rely on
Yeah.
your veterinarians for that. That's what we're here to help with.
Yeah.
The actual like act of euthanasia, I think a lot of people,
Mhm.
many people haven't been a part of it and
Yeah.
curious about it. And what I typically say to them is it is intended to be very peaceful. And I have had a lot
Mhm.
of owners that afterwards say, wow, like I wasn't expecting it to be so peaceful, and they get a lot of closure from it. So
You do.
I'm interested to hear what your thoughts are.
No, I like how you said that too. It's intended to be peaceful, because that is true. Life and our bodies and medicine, like that, they don't always cooperate.
Mhm.
So even under the best of circumstances, sometimes the body has reactions that can be startling. With that being said, Mother Nature, and when natural passing happens, all of those things can also be present and worse.
Correct.
So people who want Mother Nature to do it and have, 2 a.m. when everybody's asleep, they don't watch their pet waking up and suffering through that process. But so what we can guarantee though is sedation, and we can guarantee that they're not conscious for those things. Even if the body has a reaction, they're not conscious for it. And it requires consciousness to experience pain and suffering.
I
So
think that's a really important point. I have a lot of owners that say, gosh, I would love for my pet to just die naturally at home. And I think what we know from humans is that that can be a very terrible experience.
so
Oh, sorry, you cut
oh,
out for just a second. What was
oh,
that?
sorry. Yeah. And it can be a very long experience.
Mhm.
So, death isn't immediate. It's a phase. And I have seen videos of, because I would never allow it to continue, but I've seen like cats die of kidney failure. The active dying process takes over 3 hours.
Yeah,
Like, that's, so it's not a quick like boop and I'm done, right? It's
right.
it's it's long. I lost my uncle 3 years ago, and it was, like the real active dying process was almost a whole day.
Yeah,
And that's a lot. And we had him on morphine.
right.
We don't do that in our pets. So I think everybody can tell I'm pretty adamant about this.
Yeah.
But getting back to euthanasia, because that is where, it would be nice, because we can control things way better. We can control 99.9% of the situation. So most most veterinarians and clinics will give some lovely sedation before the final medication. And that's great if we, and it is not medically necessary at all, but it is really nice for owners to see their pets just sleeping beforehand.
Mhm.
It kind of sets the room for being peaceful. And for those that may not want to be present, I do encourage them to be present just at least for that. And once your pet is sedated, I understand. I totally understand when people don't want to be present. I think there's a lot of stigma about those that don't want to be present and they get almost guilted into it. Like your pet's looking for you and stuff like your pet's always looking for you from day one, right? Like they're always going to. So don't think it's because of this that they're scared. Um, but at least maybe stay for the sedation. And did you know that the last sense to go is the sense of hearing?
Mm.
So if you could just be speaking to your pet, they hear that until the end. Like that's amazing. Um, and then the second medication, what a lot of people then think is that we're stopping the heart. And we're not. We're actually stopping the brain. It's simply an overdose of anesthesia. So we stop the brain. The brain is an amazing organ. It controls everything. And so when that slows down and is gone, then everything else follows. And it's extremely peaceful. And, some of the quote reactions people see are really just energy leaving the body. So if we see muscles tremor and stuff like that, that's just energy leaving. If we see what we call an agonal breath, which is just actually the diaphragm relaxing, which is a muscle, and that forces air out, and it looks like a breath, so people get scared. But those things actually rarely happen.
Mhm.
It's only about 3% that happens. The only thing I actually prepare owners for when a euthanasia is happening is that they won't close their eyes.
Mhm.
And I can't stand, I don't know about you, but when I see it in the movies, when the eyes close, I'm like, yeah,
Yeah.
they like push the eye. I'm like,
Yeah.
that doesn't happen.
Yeah. That's
Like,
not real.
and you're making my job hard because people are expecting that and they'll sit there and try to do that. So I always prepare for that because that happens 100% of the time.
Mhm.
And they may relax their bladder and go to the bathroom number 2 as well. So I like to prepare that because everything relaxes and that could be upsetting to some people. But all the other stuff I don't even prepare owners for. If it happens, we'll talk about it.
Yeah, and it's very far and few between the other stuff.
Yeah, totally.
I really like how you said it's okay if you don't want to be present for the actual
Mhm.
act of euthanasia itself. I think it is such a personal preference. I do think it's
Mhm.
like you said, important for you to be there while they're self-conscious. I think like that's part of our responsibility as pet owners to be there for them. But once they're unconscious and they've had that sedation, I think if that's not something that you want to be a part of, that is okay. And I certainly don't want anyone to ever feel like, oh my gosh, I have to be here because people on the internet are going to shame me because people are very emotional
Yeah.
about it.
I can't stand that shame. And you know what? If you even can't even be present for the sedation, which I really like want people to do
Mhm.
because I think it's so good, not just for the pet, but for you and closure. Like I
Mhm.
promise you to do that. It's so helpful when you don't know and you dropped off your pet and you've got that could haunt you. But but everybody should know at the vet clinic, we love on your pet.
Yeah.
We love on them. We give them treats. We give them sedation. We give all those things, and the team will love up on them. So don't feel guilty because it's not like we're just like, oh, that was a drop off, so we're not going to do
No,
it well. Like
not
that's
at all.
no. I used to work at a shelter. We loved up on all of them, and there was a wonderful director of our shelter, Dr. Sarah Pisano, and this is before I became a vet. So this is early 2000s, and so I was making the surgery packs and whatever. And I would hear this voice down this long hallway. Here's wait. I'm like, who is that? And Dr. Sarah Pisano, every dog that walked past her office to go get euthanized, because even though we were quote a no-kill shelter, pets were euthanized because of sickness or behavior. Anyway, I'd hear, and every pet she'd say, "Hi, handsome boy. Hi, beautiful angel." And she loved up literally on every single dog that walked past her room to go to euthanasia. And it was just such a sweet thing to see that I'll never, so every pet I walk into a home, I say that, "Hey, handsome boy, hi, beautiful angel," and love up on them. And if families, I'll go to homes, it's rare, but I've gone to homes where they want me there, but they're going to step outside. They're going to go to the backyard. They don't want to be present for that euthanasia. And
Mhm.
I support that decision. And then afterwards, I want them to come back in and we make paw prints and we love up on them and things like
Yeah.
that. But it's It's hard. I watched my uncle passing, and it's hard.
Really
It's hard to
hard.
watch.
It's
It
really hard.
is.
And the last thing you want to feel is that some outsider's judging you. So I think
Yeah.
you have to do it.
No, I think shame on us if we judge them. That's
Mhm.
where I think the shame should be. And I'm really adamant about that because I've had a family member who couldn't be present at all. And she's like, I need to stay at work. I don't want to think about it.
Mhm.
And no problem. I will make sure she's got a good goodbye in my hands. And that
Yeah.
is my oath to them. So anyway, I'm glad we talked about that because it is a big topic. Or there's just one that I see creep in and I don't like it.
Yeah. Yeah. Me either. I think one thing I'm sure you have gotten this many times is people will always say to me when I was little, I really wanted to be a veterinarian, but I could never
Mhm.
euthanize a pet. Like I just could never do that. And so to that I say, well, that's not my entire job, but when I do when I do have to euthanize a pet, it's very much a privilege for me where I'm preventing them from suffering. I'm not doing it unless I feel 100% that I'm doing the right thing for the animal. And so I definitely feel the weight, the responsibility of it. But again, it's a privilege and it's just part of taking care of them.
It's so true. I own a crematory also, a pet crematory. So I'm a little unique, right?
Yeah.
And so today we had a new employee that I was talking to, and she said that exact thing to me. She's like, I could never do it, but so at least I'm still helping. I'm doing this. Like she's working at the crematory. It's just that final thing is really hard for people. And I don't see it that way. And I actually do that for a living. That is all that I do, right? So like you'd think I'd be crying all day long. I do actually cry a lot. But because I see families that love their pets. How joyous is that to see families, see pets that they're loved so much that the owners were sleeping in the living room for weeks, that they were hand making food, all the time, that they set up a party, a goodbye party, that they read I've been to, where Jewish prayers are read to their pet, like so the same cultural things that we do for our humans, they're doing for pet. Like it's beautiful. And to help usher that pet to the next stage and do it well. Like I love helping, and that's what we can do. We became vets to help animals, and it's not always to save them. And it can be hard when it's not done well. So I'll say that,
I
right?
agree.
Like 100%. And when I worked in that shelter, we still did it well, but one of the things that I took away from that, and that was 20 plus years ago, was sedation, because in the shelter we didn't sedate. And so it was very hard for me to be speaking to a pet, right, a dog, while it's wagging its tail and licking my face, let's say, right? But I know it's got a pretty severe disease, whatever, and I have to euthanize without sedation. That was hard.
Mhm.
So that's hard for me. So our shelter vets, I give them a lot of kudos, but anyway, but when you can make it beautiful and a
Mhm.
family is so grateful to you, and we get the best hugs and things like that. But I remember this one time I always say I go into homes as the angel of death, and I just leave the angel because they're just so amazed at what the processes can be.
Mhm.
And I also feel there's a bit of relief to families afterwards,
Yes.
and they're shocked at that, and then sometimes like, oh. And I kind of, and this might seem crazy that I'm going to give this analogy, but it's sort of like if you've ever been nauseous and you have to vomit.
Yeah. No.
You Right,
Yeah.
you
It's
know you
coming.
got to do it.
Yeah.
It's coming, and you'll feel better after, but
Right.
you just don't want to do it.
Right.
So you've got this time where you're like, "Ugh," and you were avoiding it, and then you do it, and then after you're like, okay, I'm better. And
Yeah.
I don't mean to minimalize what we do, but it's very much like that.
Yeah. Like, no, that really sucked, but I'm feeling a little bit better.
I'm feeling better.
Yeah.
I know my dog. Like you always miss your pet, but now your pet isn't struggling, and
Right.
your pet is not dealing with these diseases, and your pet's okay
Right.
wherever that may be. And so I think that's sometimes helpful. And I do think people will say goodbye the first time, usually too late.
Mm-hmm.
It's the second and third time where they've learned from that, and they say, no, no, I'm not going to let that happen. So it is, I want to say, the more time you do it, the better, but it's not that it's better. You manage it better.
Right. Yeah. I mean, no one writes you a rule book on these kinds of
Yeah,
things. So with experience, you
no,
definitely learn to manage it better, for sure.
totally. Yes.
For sure. I mean, even as a veterinarian, I really had to have my husband be like, listen, I think it's time. Let's do it before it gets worse. And I am like, yeah, I'm a veterinarian. I'm very objective in my thinking, but all common logical thought goes out the window.
I am the mayor of Denial Island
Yeah.
myself when it comes to my own. Like I am just, and I am the queen of quality of life assessment, I think, right? The
Right.
self-proclaimed queen of it. And it's still when you're a mom or a dad or whatever, like, pet owner, whatever, like this is so hard because we want every single day. I always say it's never long enough and one more day, but I want to make sure that one more day isn't a bad day.
Exactly. It's not,
Yeah.
then it just becomes about us and not them.
Yeah.
So, any resources, anything you recommend for owners after euthanasia? I know
Oh,
Top of Love has some resources, any support.
yes.
Mhm.
So, listen, if there's a good local support group, and a lot of people can just, search for that. But we do at Lap of Love, we do have a pet loss support group, which is amazing. So we do every single day. We have a virtual support group, which is completely free to anyone, anywhere who's lost a pet. We've got people from Asia that log in, from Brazil. And
Yeah.
if you've lost a pet, you can go every day and it's free. So there's those. Then, if you want a little bit one-on-one with somebody that can help you through some of the grieving process, we do have a one-on-one session, which I think is maybe $50 for an hour, something like that. It's not a lot. But we also have some specialized groups where we talk about children in grief, men in grief,
Mm.
cat owners, anticipatory grief. So we've got some specialized groups, which is kind of, really interesting, and we're working on more and more. And so I think that's really helpful for families. And then we also have a course, a 6-week course to help people manage through this whole grieving process. And I've made even activity books for kids called Forever Friend, and you can get them on Amazon. And they're because I think children and grief is tough for moms and dads. Like they don't know how to talk about it.
Yeah.
And so my activity book kind of goes through some stuff where we can talk about passing or, and it's not just after, we need to help them before. And that's everybody, not just kids, right? So pet loss isn't always just after.
Mhm.
So it comes because of that anticipation.
Yeah, absolutely. And I think for all the listeners out there, I know I felt really sad for a very long time, but the first few months, the can be overwhelming. And sometimes you might
Mhm.
even feel a little like silly when you're telling people, like, oh, I'm sad because I lost my dog. And maybe not everyone's a dog person and they may not fully understand, but people with animals, I find they will say to me, I was more sad when I lost my pet than when my grandma passed away or than when my aunt died. And it's just, they are like our children. And so if you're feeling that extreme grief, you are not alone.
Totally. That they call it disenfranchised grief when someone says, "Oh, it's just a cat," right? And I'm like, "No, no, that was my Herbie."
Yeah.
I actually I am what they call a second year veterinarian, or a second career veterinarian,
Yeah.
and so I was 10 years in the software industry, and it was the death of my own dog that I when I was in grief, I decided to go back to vet school. So
Wow.
I know firsthand that grief can really impact your life. So much so that I left a really good career, became a veterinarian in my 30s. So I believe that pet that, my first one that I lost, Snow White, she's watching over me and know that, I've done well because I've taken that experience and now, have come 20 years later helping others.
Yeah. Full circle.
Full circle. Yeah.
That's amazing. What was Snow White, a dog or a cat?
She was a dog. She was a Samoyed.
Oh, love
Yeah.
Samoyeds. They're great.
They're great. They're so not common.
They're
And
not.
then I got a second Samoyed and then I'm a Doberman lover too. But the best are just good old mutts,
They
right?
are
So
really street mutts.
street mutt, you gotta love them.
I love it. Well, this was great. Thank you so much. I know it's not the easiest of subjects to talk about, but I feel like with all of your experience and what you've done, with these subjects has been really helpful and it's important to talk about and have an open conversation and I'm sure our listeners will get a lot from it. So I thank you for
Good.
coming on.
You're very welcome.